There was a compensation of fertility in the early 1960s. Then we see the continuous decline of the birth happening in the 1970s. Then we see the fluctuation in the 1980s and the continued decline over the last 20 years. So that's the general situation. In general, we can see that in the 1950s, 1960s, there's a very high birth rate. Then we have the continuous declining of the mortality, except for the special period of the Great Famine period. Then we have the fluctuation period, and then we have this continued decline in the 1990s and in the first 10 years of the 21st century. Then we have the life expectancy at birth in China. We can see this kind of the continuous increase. But the speed is slower. Now, at this moment, on average, Chinese can survive up to 72 years. But of course, here we have the very huge regional diversities. For example, in cities like Shanghai, women can survive the life expectancy at birth in Shanghai is 85 years for Shanghai's woman, 79 years for Shanghai's man. So we are not so fortunate to live longer. But for some other this kind of internal Chinese provinces, like in the Qinghai province, like that in Tibet, the life expectancy is only 6-7 years. So there's a bigger gap between the coastal area and the urban areas and with this kind of inland, remote rural areas.
You just mentioned, said that 85 years life expectancy.
For women in Shanghai.
So this pollution and other things, of a major city,
So seems not to affect that. Yeah. So
normally it's taken rural areas,
yeah.
they have less.
Yeah. So that's also some kind of myth in China, with the very crowded, very polluted, but people's life is much longer than before. So that's we try to find what's the reason behind these kind of things.
So no stress, nothing is affecting.
Yeah, it's still the case. So that's very similar to what the debate happened for Japan in the 1970s or 1980s. Because in Japan at that time we said that Japan is working very hard. Their rhythm of life there is very faster. Their living space is very small, and also Japan during that time also experienced a very rapid, a very serious pollution. But Japan's life expectancy also increased very rapidly during the 1970s. So maybe it's caused by the public health or by the general living condition, changes of living condition. Yeah. Then something linked to the China's fertility. We can see that in the 1950s, on average, no matter whether you are the urban residents or you are rural residents, on average Chinese family had about 6 children per family. Then also we experience this kind of the fluctuation and the declining of the fertility during the famine years. Then in the urban area, we see the rapid early decline of the fertility in the 1960s. So then we see in the rural areas, the high fertility maintained up to the early 1970s, then dropped very rapidly in the 1970s. Just to remember, in China, the nationwide family planning program was implemented in early 1970s. So that means for the country as a whole, the family planning program really brought about a rapid fertility reduction in the 1970s. But the urban fertility decline happened much earlier than the nationwide family planning programs. So then we, for the more recent years, so that's the problem of the data. So at this moment, it's difficult. Now, the official figure said, in China, the total fertility rate is around 1.7 to 1.8. But many studies show that if we based on different kind of the survey, different kind of census, or different kind of the these kind of small in-depth studies, the total fertility in China should be lower than 1.5. But the government and many scholars do not believe this kind of the very low fertility. So the government officially figure is that China's total fertility rate is 1.8. But if you based on all these kind of the, surveys, it's much lower than 1.5. So this is a debate is still going on, and this situation is affecting the government's decision whether China should change its population policy or not. Yeah. So that's the general fertility pattern over the last half a century. Of course, this kind of the region, this kind of fertility is not homogeneously across the whole China. In China, actually, we have the many different. For example, in Shanghai, the total fertility rate has been as low as 0.7 over the last more than 10 years, but it's remained as 3.5 in Tibet, in Xinjiang, in some other part of China. So that's you will find this kind of the very largely differential fertility across China, across the rural and urban areas. So this definitely this kind of regional pattern, regional diversity of the fertility, mainly caused by the socio-economic development. So in the coast area and in the urban area, relatively developed and people's reproductive behavior are much more modern compared to the people living in the rural areas and in the remote areas. Furthermore, this kind of regional diversity in fertility is heavily affected by the China's differential in the family planning policy. Well, now, usually when we call the China's family planning program, we call the one-child policy. But actually, China never implemented the pure one-child policy. So this current population policy actually is shaped in the year 1984 or 1983. Since then, over the last 25 years, the main principle or main shape of this kind of regional family planning programs are remained unchanged over the last 25 years. So generally speaking, that's we can divide into this kind of the policy into different component categories. The first is one-child policy. So this basically is covered all the urban residents and rural couples in a few provinces, like that in Jiangsu and in Sichuan province. So this we call the one-child policy area. So this covers about the 36% of the Chinese total population. So this is a figure of the 2006. Yeah. Then we have for the majority of the rural population. So either they can have two children, or they can they can have the second child if the first one is a girl. Then for the minority population, there is some kind of general policy allowed the minority population to have 2 or 3 children on average. Then there is for the Tibet population, there is no numerical regulations for Tibet population. So that's the highly decentralized policy formation and policy implementation in China. So if everyone in China follows the government policy, then the total fertility rate in China, or we call it the policy fertility rate, should be 1.5 at this moment. That in the year 1990, the policy total fertility rate should be 1.62. But because over the last 20 years, more and more people become urban residents, and more people should follow the one-child policy, that's regulations. So now the policy allowed every Chinese to have 1.5 kids. So it's sometimes the one-child policy is a term, oversimplified terms, sometimes misleading. But anyway, we just use the term one-child policy here. But you should bear in mind that there is a difference in the regional policies. Then we know that China's population in the future will continue to grow. Although in China at this moment we have already, the fertility rate is already at a very low level. Here I show two these kind of assumptions. One is that total fertility rate remained at the current level. official